Hi, everyone. My name is Hayden Muntz, and this is my healthcare reform interview presentation. I interviewed Jody Matez, who is a group facility administrator, which basically means he covers multiple facilities within Colorado. He is involved with job placement and development. He has a bachelor's in healthcare administration and a master's in public administration and leadership. And he's also a retired Air Force major that served in medical units and air and space operation units. So for my questions that I chose, these came from our text on page 68 through 69. And the first question comes from the healthcare reform that was just introduced, and that is, what changes do you expect to see from the new executive order directed toward dialysis and dialysis centers? The next question is, how do you manage being the organization's first line of defense against legal liability? And in terms of employee relations, what decision-making processes do you have for recruitment, selection, and discipline, termination, or both? And also, how do you respond to freedom of speech issues and issues that revolve around social media? So Jody and I both work in dialysis, and just recently the Trump administration came out with an executive order that focuses on reducing the number of patients developing kidney failure, reducing how many Americans get dialysis treatments in center, and making more kidneys available for transplant. So I asked Jody how or what changes do you expect to see in our clinics from this executive order? And he said that we'll see more integrated medicine and partnerships with cardiologists and primary care physicians in order to stress patients getting in for their regular appointments to catch things that we can prevent beforehand and care for things such as hypotension and diabetes, big symptoms of hemodialysis. And then also he said that doctors will start to focus more on home modalities before in-center. And this is just for the patient's benefit, because in-center dialysis is really rough on the patient. You know, their blood is getting cleaned 3 times a week for 3 to 4 hours, where a normal kidney functioning is 24/7. And at home hemo, they would be receiving treatment each day of the week. And also, it will just create a smaller footprint on dialysis and dialysis centers. And in all reality, peritoneal dialysis or home dialysis is the better model. For my second question, I asked, how do you manage being the organization's first line of defense against legal liability, and what resources or policies and practices do you turn to or utilize? And he basically said that the policies and procedures that we follow are directly from CMS standards. They are developed from Medicare and Medicaid, and we just ensure that those standards are being met. And in addition to that, we set a higher standard. Our organization sets a higher standard than what CMS dictates. So we know that we are meeting the standard and plus some. And then also, for legal questions or issues, we have compliance departments such as Risk and TeamQuest, which is basically just a team of lawyers that deal with legal allegations or situations within our clinics. For my third question, I asked, in terms of employee relations, what decisions or decision-making processes do you have for recruitment, selection, job advancement, discipline, termination, or both? And how do you make sure you're within compliance with federal employment laws such as FLSA or FMLA? And he basically just said that there are teams of recruiters and departments that are used for background investigations. There's also interviewing grids that are utilized to make sure that the questions that are being asked are pertinent to that specific position. as well as they are falling within legal boundaries. He focuses on using aggressive disciplinary actions when it's necessary, and that's just to increase the speed and efficiency of solving an issue. And for accelerated terminations, we utilize Employee Relations Department. They review the situation and documents and proceed with further actions. My last question, I ask, how do you respond to freedom of speech issues and issues that revolve around social media, and how does that relate to searching employee spaces or expectations of privacy? And he said that the main concern is patient care and privacy. He would ask if the incident involves a HIPAA violation or compromises patient safety or information. Then they would use social media or investigate further into the social media outlets for that specific situation. Otherwise, he does not use social media to investigate people, only when that issue pertains to social media. He does use applications such as Indeed or LinkedIn as ways to recruit and to hire. And that's pretty much it for social media. In summary, what I really learned from this interview was that we emphasize a strive to succeed mentality and to do better than the standards that are put in place, not only for CMS and falling within compliance, but also for the care and the expectations of our patients and meeting and exceeding those as well. Also, utilizing every resource that is available is extremely valuable, especially when you're working for a large corporation. These teams dedicated to employee law and compliance are extremely valuable in what they do and the information that they provide. And then also always keeping the patient as the priority in all the decision-making processes that you do and employee relations that come up. The patient should be the priority. And that is all I have for my presentation. Thank you all for listening, and I hope you have a good rest of your day.